Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Knee to Know Show, we're going to talk about managing fatigue and tiredness after knee replacement surgery. Before I hop into that, be sure to hit that subscribe button below if you're interested in catching regular videos related to knee replacement surgery, the surgery itself, exercises, frequently asked questions, everything else in between. So let's hop into this. When it comes to fatigue and tiredness after knee replacement surgery, this is extremely prevalent and very common and very normal. Your body is working in overdrive to heal and recover after a very significant surgery. So it's very common, very normal to have this level of fatigue. And there's also these other factors that of course are playing a role, multiple factors, such as pain medicine. Taking pain medicine can lead to some drowsiness and fatigue. The wearing off of any side effects from the anesthesia that you might have had after surgery. You have trouble sleeping, most likely, and difficulty getting as much sleep as you normally do. You're dealing with pain and other symptoms that just make different activities more strenuous and take more energy out of you than they normally would. So there's a lot of different factors that play a role in fatigue after surgery. Something to keep in mind is we want to accept that this is kind of the nature of the situation, accept that this is common and this is okay to experience and deal with. The important thing and the good thing is that for the vast majority of people, this is temporary. As you heal and recover and build up your energy and strength and endurance, you're going to have less and less fatigue and feel more and more like normal. So accept that this is part of what's going on right now and part of the healing and recovery process. But it is temporary and you will feel better and better and have less fatigue over time. So let's look at some particular issues and concerns when it comes to fatigue and tiredness and what are some things we can do about it. So one is sleep. Very common, very normal to have some difficulty falling asleep and getting as much sleep as you normally do due to discomfort, stiffness, pain, things like that are keeping you up or waking you up during the night. So make sure you're playing around with trying to find the best sleeping position for you. So this may be laying on your back with a bunch of pillows on your legs so that you can elevate the leg up in the air. It may be laying on your side with some pillows between your knees. Play around with pillows and maybe a bolster, things like that, to try to find a position that allows you to fall asleep and stay asleep as long as possible. Also, make sure you're just practicing good sleep hygiene. So falling asleep and waking up at the same time every day as best you can. Trying to keep a good environment where there's limited or no noise, where it's dark, where the temperature is set appropriately, that you can fall asleep and have a good sleep. And just general things like limiting screen time prior to falling asleep is important too. And then also some things you can do prior to falling asleep, kind of that half hour or 45 minutes before going to bed, is things like making sure you're taking some pain medicine, doing some heating or icing to the knee, maybe some massage or soft tissue work to try to decrease any pain or stiffness so that you can hopefully fall asleep a little bit easier. The next thing I want to talk about is nutrition. So make sure that you're getting adequate nutrition. Your body needs more energy, needs more nutrients after surgery. So make sure you're getting all the macronutrients, carbohydrates, fats, but an important one is especially protein. Your body and your muscles are atrophied and weakened after surgery, especially in your legs, your quadricep muscles of your thigh. So make sure you're getting that protein that's going to help promote synthesis of proteins and muscles in your body. Otherwise, you want to make sure that you're eating healthy. So try to limit processed foods. Try to limit foods that are high in sugars, high in saturated fats. Try to eat a healthy diet. Lots of fruits and vegetables, whole grains, nuts, seeds, legumes. All these things are going to be really helpful and have lots of nutrients. They're going to promote healing and recovery faster and also give you the energy that you need throughout your day to tolerate physical therapy, to tolerate your daily activities. The next thing I want to talk about is pain management. So pain can feed into and contribute to fatigue and tiredness just because it takes more out of you to do different daily activities and things that you would normally do. So make sure you're trying your best to manage pain effectively. So this means taking your pain medicine appropriately, but it also means things like icing, heating, maybe you're using TENS or electrical stimulation. Maybe you're practicing some sort of mindfulness techniques such as meditation, or maybe just some deep breathing strategies, or whatever that may be that is appropriate and works well for you. And also, of course, some light exercises and stretches as well. Also, a big component of fatigue and tiredness is the psychosocial aspect. So things that are common after surgery is depression, anxiety, loneliness, hopelessness, all sorts of psychological, mental health components that can play a role into your fatigue and tiredness, as well as other symptoms. So doing your best to take an active role to try to manage these things as best as you possibly can. And of course, realizing that you are still human and we all deal with these things, especially after, going through a major surgery and recovery. You're going to have some of these emotional aspects, mental health aspects to work through, and that's perfectly okay. But do your best to take an active approach. So this means maybe reaching out for social supports, planning social activities to do with others, just planning activities by yourself, such as going for a walk or spending time to just relax and read a book or watch some television or whatever that may be. Practicing mindfulness techniques if that's something that you find beneficial, such as deep breathing, meditation, going for a walk again. Also means things like seeking help from a professional if it's appropriate, and don't be afraid to do that, and don't feel like you're a failure or anything else to do that. There's a reason that they're there to help you and give you that support, and it can be really beneficial to help with fatigue and tiredness and many of the other symptoms and emotional, psychological, mental health aspects that come along with the rehab and recovery after surgery. A couple other things to keep in mind are try to schedule out your days. So schedule breaks, times to just rest and recuperate and recover throughout your day. You don't have to be going 100 miles per hour. In fact, I wouldn't recommend it, especially as you're rehabbing and recovering after surgery. So plan out your day, plan adequate rest and time to do things. Make sure you're timing when you're taking your medicine. So of course your pain medicine, trying to take some before physical therapy sessions, trying to take some before going to bed. But also things like if you take a diuretic, try not to take that right before you fall asleep at night so you're not getting up to use the bathroom all the time during the night. Also things like taking naps. Naps can be really helpful to help rejuvenate and decrease fatigue and tiredness. But be strategic about it. Limit them to maybe just 1 or 2 throughout the day and keep them relatively short, maybe in the timeline of about 20 minutes so you're not up all night because you napped and slept too long throughout the day. And also a really important thing that I want to end with is exercise, physical activity, physical therapy. Don't skip out on that, even if you are fatigued, even if you are tired. Of course, it's important for the benefits of rehabbing your knee replacement and getting your range of motion and your strength back, but also exercise in the long term can help with managing fatigue and tiredness. It helps regulate your system. It helps build up your tolerance to different activities and your energy levels, and it helps you with establishing a good sleep cycle and sleep pattern and falling asleep better. So although exercise may be fatiguing and you may feel tired in the short term when you're doing it or right afterwards, in the long term it can really have tremendous benefits for managing and dealing with fatigue and tiredness effectively. So I hope you found this video helpful and got some useful tips to deal with your fatigue and tiredness and drowsiness and sluggishness after surgery. Remember, it is common, it is normal, it's just, the nature of the beast, so to speak, and it will get better. Be sure to hit that like button if you found this useful. Be sure to leave your comments and questions below. And again, be sure to hit that subscribe button and turn on the notifications if you're interested in catching more videos like this. I post a video every other day, all related to knee replacement surgery. Thank you very much for watching.